So, welcome to our latest installment of the New England Medical Cannabis Seminar and Support Group. Tonight's guest is Wendy Love Edge, who is the founder of Bulldozer Health, a 5031c nonprofit organization, and she is a medical cannabis activist. Welcome, Wendy.
Thank you so much for having me. So good evening. I'm really excited to be in Connecticut tonight. As Stefana said, my name is Wendy Love Edge, and I'm the founder of Bulldozer Health. We're a 501c3 nonprofit organization and healthcare reform initiative. And our mission is to educate everyone about all their health options, improve access to alternative health care, which includes cannabis, or healthcare, like I like to call it, and inspire people to optimal health. And I started the organization out of my own personal experiences with the healthcare system and becoming ill using the healthcare system. And so, so I became ill in 2011, and I contracted a disease called dermatomyositis. It's an autoimmune disease where your body eats your skin and muscle cells. And in a very short time, I found myself in a power wheelchair, unable to care for myself, and on 16 pharmaceutical drugs. The doctors told me that I would die from this illness or from the treatment that they had to give me, and the main problem was that I believed them. And so I wanted to do everything they told me so that I would live. I really wanted to live. And so my partner at the time had to bathe me and dress me and help me into this power wheelchair. And I had a giant pillbox because with pharmaceutical drugs, one drug leads to the next drug, leads to the next drug, until I was what I call now completely bulldozed on pharmaceutical drugs. 2 years later, I was still on all the drugs. I had improved a little bit. When I got sick, I was living in Arkansas. I had been an occupational therapist for 25 years, had a great career, and I married somebody from Arkansas, and I was very hopeful and excited to move there. But once there, I was working very hard. I'd gone back to treating patients. I love treating patients. And before long, I started to become very fatigued. I had trouble doing exercises with my patients. I was tripping over my feet, and then a rash developed on my belly, on my hands, and up onto my face. And my mother had taught me to always press on, right? So I knew I was getting sick, but I kind of just kept working and kept pressing on. And then a coworker looked at me and said, you look sick. And she was right, So I went to the doctor, and they diagnosed me with this illness. And so in Arkansas, if you can't pay the doctor for your visit, you can't go to the next visit. So as sick as I was really struggling. I had been the breadwinner for our family. My wife is a musician and was, basically unable to tour anymore, was taking care of me. And so we were really stuck, and we started selling our belongings to live and to eat, and finally decided we should go back to Massachusetts as soon as I could walk to and from the car by myself, even with a device, and use the bathroom by myself. And so that was our goal, and we met that goal. And I wanted to come back to Massachusetts because I knew that there was health care for everyone. Mitt Romney, who then wouldn't admit that he created this great healthcare system in Massachusetts, did actually do that. And so I knew if we went back, it would be easier anyway. But I was still in the mindset that I could die, and I wanted to continue all the drugs that they had me on because I thought that's what I needed to survive. And so we did. We went back to Massachusetts. As I said, I had progressed a little bit. I could walk on arm crutches, but I couldn't drive. I couldn't do many, many things. And then I had a life change. In 2013, found out, I ended up alone. And I had friends helping me to the best of their ability, but I was in and out of the hospital all the time. My immune system was completely shot from all the drugs that I was on. And unbeknownst to me, I was addicted to Percocet and morphine and Valium because the drugs that I was on, such as steroids and gabapentin and all those drugs, create other problems. Like I said, one drug leads to the next drug leads to the next. So I was pretty upset and angry with the situation. I didn't know what to do. And then about 2 months later, in the fall of 2013, I changed my mind. When I say I changed my mind, I decided that I could be healthier. And so I started doing affirmations. That was the first thing. I told myself, I am healthy, I am well, all day, every day. I wrote it down on a piece of paper, I put it on the mirror in the bathroom, I put it on the refrigerator. I learned and realized that my body could heal itself if I just put it in the right conditions. And so I started really thinking about that. And then I made a decision that I can't recommend to others, but it was right for me. I decided I would wean off of as much of the drugs as I possibly could. And so I started the weaning process. And in a very short time, I was in full withdrawal, shaking, sweating, unable to formulate a sentence. And I called a friend to help me get some groceries, and she sent an acquaintance of mine, it was a friend of hers, and she showed up at my house and took one look at me and said, my gosh, you look worse than you did, what's going on, you know? So I explained to her, you know, I'm weaning off these drugs, I have to see what my body can do, it's the only way I'll know what's going on. If I have anything left, I have nothing to lose, really. And she looked at me and she said, have you tried marijuana? And I hadn't. You know, I hadn't since high school. When I was in high school, you know, I tried it, right? And then years go by. It just wasn't in my wheelhouse. I hadn't thought about it in many, many years. And I worked in healthcare where they drug test you. Like, it just didn't even occur to me, you know. And so she said, listen, Wendy, I'm telling you, it's medicinal, and I have some in the car. See, this is what I learned as I went along. All my friends were cannabis users. They just didn't talk to me about it because I wasn't. And that's kind of what happens sometimes, right? But she knew a lot about it. She was in her 60s. She had used cannabis her whole life. And so she brought it in, and we smoked. And with just a few puffs, the pain went away, and the withdrawal symptoms went away. Now, I was no stranger to illness. Earlier in my life, I was diagnosed with psoriatic arthritis, psoriasis, coronary artery disease, I have stents in my heart, diabetes. So I had a lot of chronic illnesses, but I was always able to function, you know. I was given some pharmaceutical drugs over the years, but I was always, you know, I was able to function, raise kids, have a home. This was totally different. This illness really put me in a place where I probably would have died had I followed the plan of mainstream medicine, right? Which is keep adding the pills and treating the symptoms and not treating the person fully. And I say that, you know, I know there are many allopathic physicians who go into it for all the right reasons and really do care about their patients. But let's face it, what's available to us? Pills, tests, or surgery, right? That's what the system will offer if you stay within it. So anyway, going back to the story, the symptoms all went away, the pain reduced to almost nothing, and I knew that this was my medicine immediately. But I also knew that, well, you know, it wasn't really the whole story, and I'm going to get into that in a few minutes. But one of the issues that I ran across right away was that I had to pay out of my pocket to go and see the physician. It was $200 in Massachusetts, and then $50 to the state, all out of pocket. My own physician couldn't write recommendations because if they take federal funding through Medicare or such, they can't write the recommendations because it's still federally illegal. It was when I started and it still is today. Schedule I drug. Needs to be descheduled, right? But at the time, so I'm reaching into my pocket paying and I'm all excited. I finally saved the money, go and get my recommendations, and I'm like, where do I get the medicine? And at that time in Massachusetts, they couldn't even tell me. They only had caregivers and no dispensaries. So I had to investigate everything. And I could have at any time driven down the street and picked up my pills at the pharmacy for next to nothing, right? But if I wanted something different, I was reaching into my pocket. Then I did a little more research about alternative health care, or healthcare really. And I decided to go and see a chiropractor. Now, I was still walking on arm crutches, and I really, you know, over the years with the psoriatic arthritis, I had, you know, been in and out of the hospital and had lots of issues with my spine and my legs, and but it never occurred to me to go and see a chiropractor. I don't, and I was a health professional, but in mainstream medicine. So I went to the chiropractor, and I saw him several times. Again, I had to pay out of my pocket. He made a deal with me. He was wonderful, something that I could, afford. And before long, I put the arm crutches down. And I remember that day, I walked into his office and I could look him in the eye. When you're in a wheelchair or walking on arm crutches, you're not really looking people in the eye. And so it was such a wonderful experience to be moving forward like this. But I knew that I needed other elements of health, right? And so the first thing for me was changing my mind and becoming more positive, meditation, affirmations, deciding I could be healthier. I also had to stop owning the diseases. When you stop saying my diabetes, my arthritis, my dermatomyositis, when you stop saying that, you're not owning it anymore. It can leave at any time, right? So the positive thinking part and the reinventing my mind was vitally important. And then the pharmaceutical review, going over all the drugs and figuring out, does the benefit outweigh the risk to taking this drug? We all have the power to make that decision. It's not up to the physician really to make that decision. We need to do our own research. And so then the next step for me was also really looking at diet. Okay, so that is the building block of our health. And boy, was it an eye-opener. I had been a vegetarian actually for many years, but I really hadn't done a lot of research. And what I learned was, if you're not eating organic food and skipping the dirty dozen, you're putting poison into your body. And what's available to people? What is available? Many people are working 2 jobs. They're trying to make ends meet, and processed food is so much more readily available and fits into their budget. And so I also realized, wait a minute, this isn't accessible either. None of the things that I was trying, whether it was cannabis or going to see an alternative health provider or choosing healthy organic food, I was reaching into my pocket to pay for these things. And then the fourth, what we call them remedies for health, so that's what I'm building on here, positive thinking, pharmaceutical review, nutrition, and then the fourth one is exercise and rest, right? So in the beginning, I had been on arm crutches, I had been in a wheelchair, wasn't really moving my body. So in the beginning, I just kind of started with, I'm watching something on TV and I'm going to stand up and walk in place and lift my arms up, And then it progressed to just walking from my house to the next house, which is literally like right next door and back home, And then I learned that I could go to a place like Planet Fitness. It's not a plug for Planet Fitness, but I do love it there. It's affordable, and it was something that I could do. I actually love the gym. I love competing with myself, and I had forgotten all that. When you're ill, you can't, if you're in that mindset, the sick role, right? It's hard to remember that these things are all important to your health. It's like, wading through the illness and everything that you're holding on to because of the illness and making these positive choices. So I started moving my body, and then my friend who originally came to bring groceries and then taught me about cannabis, she decided together we would go and start swimming. And so we went and we started just walking in the pool, and just that, adding that to my life really improved my health and well-being, because I could start to really move my body and then progress to walking on a treadmill and doing other things that are healthy. Just increasing your fitness level a little bit does so much for your health. And so all of these elements together were important, because what I learned is, you can't spell healthcare without THC. We all have an endocannabinoid system, and the endocannabinoid system wants the cannabis, wants the CBDs, wants all of the elements. It's really important to use the whole plant so that you get the entourage effect on your body. I love now to use it in all different ways, whether it's tincture, some edibles, smoking, all of these things bring different elements of the plant and affect your body in all different ways. So it really can get an education when you start to really look into it and how it can help your body. But it's total health care. And I borrow Total Healthcare THC from Dr. Uma, another wonderful physician who has worked with our project. You know, that's her thing, Total Healthcare THC, and I love it, and so I always use it. We actually have t-shirts with that on it also, because Total Healthcare includes cannabis and all of the things that I just talked about. So it's not the whole story, and when you're looking at natural healthcare, it's really important to add all of these elements. And there's even more. We've done seminars where we ask people, what does health include? And come up with a giant list of things, everything from, you know, how you spend your free time, your leisure time, whether you spend time with animals, whether you pursue leisure activities, you know, whatever it is, all of these elements are so important, and cannabis is an essential ingredient, but it's not the only piece. And so please, as you start to make your decisions for your own health, really look at all of these elements. So what I found out is that not only was I struggling to obtain these things for my own health, but everyone is struggling. You know, I had a great career as a therapist. I was a regional director for a rehab company, had a great career, made some money, right? But in a very short time, everything was gone. When you become ill in this country, many people end up often near bankruptcy. It's really horrible, and we all need to stand up and continue to talk about it and try to do something about it, anyone who has the ability to do that, because everyone is struggling from what I learned. And so I decided to start Bulldozer Health to help people access these things. And in 2014, my 14-year-old son Antonio and I filled out nonprofit paperwork, and he put up a website. He's an amazing whiz on the computer, taught me all about social media, and in a very short time, people were hitting our website because we were saying, you know, we will help you to access these things. And so this is what we do. We network with providers. We have alternative health providers, acupuncturists, chiropractors, physicians in our health network. We hold events and raise money, and the money goes for patients. So a patient applies to us, they want to see a chiropractor, an acupuncturist, and they apply on our website, and then as money allows, we pay for the visits to the people that are in our health network. We also help people to access doctor's visits. We have a relationship with CannaCare docs and with some other doctors, and so if people can't afford the doctor visit, they can also apply to us to help get the doctor visit covered. Because this is it's a chunk of money. There are a lot of people who, whether they're on disability or they're just making minimum wage, it's very hard to come up with $200 to $300 to see the doctor. And then the state fee in Massachusetts is waived if you're low income, but in Connecticut it's not, and it's not in Rhode Island either. So we operate in Connecticut, Rhode Island, Massachusetts, and Arkansas, because I got sick in Arkansas, so it's very important to me. It was very important for me to go back. And when we were first going to Arkansas, you know, it's challenging because when I leave the state of Massachusetts with any medicine, I'm a criminal. Even if there's reciprocity with the state like Rhode Island, I can't bring it into Rhode Island. I can go to the dispensary with my card and purchase in Rhode Island. And so I went to Arkansas knowing full well that I needed the medicine. You know, without it, my energy level is very low.
Me too.
Yeah, without, you know, and I'm in a lot of pain. And I have some other neurological issues like neuropathy and myasthenia gravis. And so these things, you know, without the cannabis, you know, I start to have eye droop in my left eye. I start to have trouble standing, you know, and I need the right strains. So here I was going to Arkansas, who has nothing legal, and it's frightening, you know. So I didn't bring anything with me. I flew the first time I went back, and I filmed myself deteriorating, you know, because that's what happens. And I was there to start a health network like we're doing in Massachusetts, so I went and met with a couple of providers who said, oh yeah, we want to do this. They joined our health network. And I told them, we talked a lot about cannabis, and then one of them called me and said, Wendy, I want you to come get some tomatoes. I have this great garden. And so I went to get the tomatoes, and I opened the bag, and I was like, yes, And so it's, here's the thing, it's medicine, right? So what other medicine do we have that when you leave the state you can't access? If you're taking gabapentin or Cymbalta or any drug, right, you can go to a pharmacy like Walgreens is all over the country, CVS, you can go and get it. But with cannabis, it's not true. So we still have a lot of work to do. And thankfully in Arkansas, they just passed medical. And so we just had a medical conference there in August, and they're about to open dispensaries in the spring. And it's very exciting to see the progress. This is in the South. We don't know. If you haven't been to the South, I'm telling you, it's a whole different animal. But it's exciting because that was really the first Bible Belt state that didn't pass just a limited CBD law. They actually passed medical, and there's qualifying conditions, and they're opening dispensaries. So I'm very hopeful. But there's still a lot of work to do. We should be able to go state to state with our medicine. We should be able to grow our medicine. The drug needs to be descheduled. It should not be a Schedule 1 drug like heroin, right? So there's still so much work to do. And I also want to bring up an issue that's in front of us right now. So we've had the good fortune and fun to join with Illegally Healed. If you guys don't know Illegally Healed, it's an organization in the South, started in Arkansas. Corey Hunt is one of the founders. He's voraciously been working on cannabis activism for many, many years. And Colton Turner, I don't know if you know of Colton Turner, but he has had huge success. He's 17 years old. He's been in remission from Crohn's disease for 3 years. His family had to move to Colorado so he could access the medicine. So we've joined together with those other two organizations for several projects. And one of the projects is that there's an amendment that will be looked at on December 8th by Congress. This amendment has two very long involved last names that I can never pronounce without looking at it. So I'm not gonna, I can tell you afterwards if you're interested. But this amendment protects us from the federal government coming in and arresting patients and arresting people who grow, even in legal states. And if Jeff Sessions has his way, he will make sure that this amendment is removed. And then all of us will be at risk. And so we are going to go to Washington in November, and Dr. Steph hopefully will be coming with us, and these other organizations are going to meet with congressmen. And we're bringing patients with us. I'm a patient, to talk to the congressmen and let them know that it is medicine. It's really vitally important. I have no problem with recreational cannabis. Let's face it, it's a lot healthier than alcohol and other drugs, right? And really, it's all medicinal. If you look at the reasons why people do these things, it's really all medicinal. But as patients, we're all at risk. And we need to really all use our voices as much as possible, make sure that everyone around us knows that it in fact is medicine, and that we need this medicine to treat our ailments, whether it's physical ailments or emotional ailments. It works better than most of the pharmaceutical drugs out there. And, I'm not against pharmaceutical drugs. Sometimes they have their place, but you have to look at, does the benefit outweigh the risk for me? Every body is different. And every body responds different to cannabis. It isn't for every single person. I can say that right now. People, don't like to hear that. But like any herbs or medicine, every person's body is different. So you have to try it for yourself and see what works. Keep a journal when you try different strains, what works for me, what doesn't work for me. Talk to your doctor. If you have a great cannabis doctor like Dr. Steph that you can talk to, that's wonderful, And having that doctor-patient relationship is of great importance to all of us, and really keeping it based in science. Because the more we do that and the more we, use the correct terminology, not call it marijuana, right? But, cannabis medicine, tomatoes, yes. It is as important as the tomatoes, So, or more maybe. But, for me, I found my medicine, and through that, I also found health empowerment and realized that I really, the bulk of the health is really in my own hands. I might be labeled with these different diagnoses and issues, but there's always alternatives that are healthy that you can try, And like I said, all those 4 building blocks that I talked about, it doesn't even matter the order, although for me the positive thinking had to come first, changing my mind, because the decision to be healthier, it doesn't mean all these things go away. It means that you're looking at life in a more positive manner, at your own body in a more positive manner, and that takes you forward to new things, And other herbs also are very important. I use turmeric, every day for inflammation. There's other herbal treatments that you can look at and talk with your health providers about and figure out what really works for you. But I feel that it all works in combination, and we all need to call it total health care, right? So I will take some questions, but I always ask every group of people to do me a favor, because our tagline is "Take Back Your Health, America," and it's really empowering, and I love to hear everybody say it. So if you will indulge me, when I count to 3, can everyone say "Take Back Your Health, America"? Would you do that? All right, you ready? 1, 2, 3. Take back your health, America! Woo! Yes, thank you so much.
Very good.
Thank you.
Wendy, thank you so much. And
Thank you for having me.
yeah, really.
You can visit us at bulldozerhealth.org, and we do have events in Connecticut. We actually are looking at having a health fair in November. We have providers. We'll usually have some music and inspiration speakers. So
You go state to state?
Mhm.
To, yeah, to
Yep.
that.
Yep. So I'll let you know about that.
Your last statement about talking to your healthcare provider doesn't really pertain in Connecticut a lot because we're not covered. Our insurance companies don't cover doctors that do this. I mean, I
Right.
have Dr. Pecher, to get my license, my medical card.
Right.
But I can't ask her any questions. I can come here and.
That's why we have this venue.
Yes.
Right.
Yeah,
Right.
that's why we do
Right.
this.
A lot of different
Connecticut is very interesting.
Yeah.
I'll say that. But there are rules for all, even with Dr. Uma as well. We've talked about that she is under the same issue, but she holds a group like this. And there are, I understand what you're saying. It's difficult. But you can talk with your doctor about all the other elements. And then come to a meeting like this.
I tell my doctors, and they just write down medical marijuana, and I say, don't you want to know what I'm taking? They say, no.
Because they don't know. They have not been educated.
Some are opening up. I had a gentleman who's like 70-something doctor, and he's the one who suggested it to me.
Nice.
So,
Right.
and I interject.
It's definitely,
It took me 2 years for you.
there's definitely positive change coming, and people, taking a stand and opening up. One thing that happened to me, I do have, heart issues. It's stable right now, but about 1.5 years ago, I had angioplasty again. With all the health changes, I was so upset, And so, but I have a strong family history. There's just a lot of stuff. So, anyway, I got really nervous, and I'm a cannabis activist, I'm a cannabis proponent, but I got really nervous because there's a lot of articles about how it can negatively affect the heart. You have to be very careful about what you read. And with all my changes, I started to get really worried about it, So I cut back, and the anxiety went up, and the depression was a problem, and the pain is a problem, which creates more cortisol and makes you more sick. So I went to see the cardiologist, and to my surprise, he said, Wendy, you look totally different than when you came in before the surgery. You need to use more cannabis. And he wrote it in his note, which went back to my primary doctor. And she said, I've never seen a doctor write this. But so it's things are happening. It's moving in a positive direction.
I know you said you're going to Washington in December.
November.
November.
Mm-hmm.
Up until months ago, that 4 months ago, right? In the Walker's basically on my knees crying. These pain management doctors have 120 milligrams of morphine, 40 milligrams of Percocet a day.
Yeah.
Now,
Sound like something?
according to the federal government and their guidelines, I was still allowed to go on dump truck.
Right. Right.
That's
Now, I've gotten down to 15 milligrams of Percocet. It keeps the edge off, but I'm still on chronic pain.
Right.
Is there any way that somebody, I know the bozos out there change their mind on as far as this, and it makes no sense that I can't go home, take a cannabis gummy bear at 6 o'clock at night, get some relief.
Right.
You know, I'm still gonna have to take Percocet maybe a couple of times, maybe once a day. Are they ever gonna change their mind down there?
Well, I think that again, there are some congressmen who understand and are very are on our side, and our plan is we're going to make some appointments to see, like whoever your congressman is from Connecticut, whoever mine is, but then we're also just going to go door to door and talk to the congressman. And Illegally Healed has done this before and made some progress, but that is a really great point. So in Massachusetts, they actually just passed an amendment where if the workplace can't fire you for using cannabis. Now, I don't know all the ins and outs of it, and I'm sure operating equipment is probably different, but they will let you, listen, I was driving around popping Vicodin, right, before because of the arthritis, and nobody cared, right? But with cannabis, the idea that the ideas that people have about it go way back to reefer madness. We have to keep changing mindset. And that's a really good point. I mean, that's something we should bring up while we're in Washington.
Wendy, can I ask you something? Do you get drug tested?
I get drug tested, that's just the thing. Now, random urine test, and I'll speak up to this, I don't care.
Yeah.
I work for a municipality. Now we have random drug testing. Now I was on all that stuff, random drug test, never got caught. With morphine and everything else.
Right.
It was prescribed by,
Right.
I hate to say it, use this word, but basically pain management doctors are just legalized drug.
Right. Drug dealers. Yeah. I'm with you.
I always pop plate.
Right.
And it makes no sense at all.
Well, it's clean because they're not looking for that, or you have a prescription. But here's the problem, doctors can write recommendations for cannabis. It's not a prescription, and until that changes, there's still so much work to do. And that's a really important point that you brought up.
Because I went to I went to the union rep. The union actually doesn't have a problem.
Right.
It's the federal government.
Yeah.
It's their guidelines. I mean, she had to write down on that paper my DOT list of what I was on. Come on, people. If I had to look at a piece of paper like that and said this guy's driving 60,000 pounds worth of steel every day and he's hopped up on this much stuff, I'd pull a CDL in a heartbeat.
Right.
But it's perfectly legal.
Right. Well, because Big Pharma owns everyone.
I was gonna say, it's a
Oh.
lot because of the lobbying of
Right.
the pharmaceutical companies, these congressmen, and the lies that they tell about certain, about medications being safe and then certain other medications being harmful, like blatantly lying about marijuana like they did in the 30s about what it does to you. Like I said, the lobbying, that's what.
Well, and the pharmaceutical companies, they have paid a lot of money to keep cannabis
Right.
in the place that it's in. When we started this project, one of our first projects was to try and get drug ads off of television. It's still a project that we have. I went and visited Congressman McGovern and talked with him about it. Senator Warren, they're on our side. These drug ads. When I was really sick, I was like, I kept thinking, I'm watching these drug ads with people running through the fields, I'm like, am I on the wrong pills? Like, and I'm, an educated person. I was like, so they are pervasive. They're in our ears, in our eyes, they're in magazines, radio, television, and it should be illegal because why are they marketing directly to the patient when the physician is the one that makes those decisions? And frequently people I did it. Go to the doctor and ask about this drug that I saw, because it's marketing. It's just like when they're selling Coke or any other product, it's the same marketing with subliminal suggestion, and it's allowable, and it should be illegal.
It's because we won't let them in the door.
Yeah,
That's why-
right.
Excuse me, I just wanna make one point, and my son says this all the time too. If there's a commercial for it, it's not good for you, because if they have to market it to you, then there's something wrong with it. And that goes along with everything. Think about it, every food product that there's a commercial for.
That's how they have to get it out.
Right, every,
Well, and-
everything that there's a commercial for,
Mm-hmm.
there's no commercials for fruits and vegetables.
No.
Right, right.
They don't say, hey, eat more fruits and vegetables. No, but they're dairy commercials, you know.
Well, that's a
dairy
whole nother,
industry-
that,
that's
right.
the dairy
Yeah.
industry marketing that, oh, almond milk is not good for you, know what I mean? Like,
The cattle and dairy industry
Oh.
also, you know that they are the largest contributors to the American Diabetic Association and the American Heart Association. So those organizations are never going to tell you not to eat dairy and meat, but it's very important to look at how those are sourced also. I became vegan not that long ago. I was vegetarian for many years. I think it's something that everyone needs to decide for themselves, but you know, the hormones and antibiotics that are in all of those products are not good for us. And also the environment, the amount of water that's used for the cattle industry, and you know that greater than 50% of greenhouse gases are from the cattle industry. So, you know, we are being marketed to and fed all of this information, and it's not the right information. It's all about greed and money. And once you realize that and you're more awakened, then everything starts to kind of click into place about how you can really work on your health. I'm sorry, you had a question.
One of the things that to follow up on this discussion, the goal is to get it accepted by the congressman
Right.
and to have them vote in favor of it. And I found that most people, if they see a first-hand experience or hear a first-hand experience or witness a first-hand experience of someone who is using medical cannabis and solve the problem,
Mm-hmm.
they're an instant convert. I was talking to a policeman down in
Senator White
Charlestown.
House
I'm
is
from
that.
Rhode Island now, and his father is going through recovery of whatever the illness is using cannabis. And I said, so how do you feel about that? He says, I really didn't have much to say about it before. He says, but now I really care.
Mm-hmm.
He says, and I respect the people that are using it.
Right.
And he
I
says,
think-
you shouldn't be ashamed to use it
Right.
and have that shame reflect in your actions.
Well, and that's why, you know, for me personally, it became really important on social media to show myself smoking because, you know, yes, people talk about vaping is better, whatever. For me, if I'm anxious or going to have a panic attack, the smoking is what's going to get rid of it right away. You know, if I have terrible pain, the smoking. So, you know, I think I decided by showing myself doing these things, people get used to it and it reduces the stigma. And you're absolutely right. Once someone has some personal experience, like they know somebody who their cancer went away or improved or, you know, right, you know. So.
Okay, I am going to say something about this amazing woman here, okay? I am a recovering opioid and barbiturate user. 1 year. Okay, one more drug to get off of, but I'm close. She's been amazing. Before she knew about medical marijuana, she told me to try it, and she knew I used it. I mean, I'm a hippie, okay? I've been using it since I was 16. But even before she... Always. No, wait, I'm in Connecticut, I can't. I'm Rhode Island, honey. And I still have times where my pain is excruciating, and if I'm feeling like I'm slipping, I go see Dr. Steph because I know she's not going to give me a prescription, she's going to give me love.
Well, and that, you know, that relationship is really important.
It's amazing.
And she is amazing. And you know, and doctors like Dr. Steph are so invaluable to all of us. It isn't just the cannabis. That's kind of I say just like I said, you can't spell healthcare without it. You need it, right? In my opinion, for many people. But that is so true. Just having someone who's knowledgeable that you can connect with when you're not feeling well is invaluable, you know. And that's part of what we do too. I spend a lot of my time, people message me or email and we just chat about things that they could try. I can't give medical advice. We do have a TV show and radio show. It's called the Bulldozer Health Show. It's on iTunes, SoundCloud, iHeartRadio, YouTube. It's on 3 TV stations, 2 radio stations, and we're expanding. I interview physicians. We just did a show with Dr. Steph. Please watch it. It's about autoimmune diseases and connective tissue diseases and cannabis. I interview alternative health providers, activists, people who have found health through these various means, nutritionists. I mean, we've done 57 episodes, I think. So it's very informative. That's part of our mission to educate people. And apart from that, this is my passion. I am still disabled. I do this all on a volunteer basis. Everyone who works with us is a volunteer. But it really is something, I want everyone to know that there are options and to have access to whatever those options are. And so that's what we're doing. And it's so great that you have a doctor here who's willing to actually spend time with patients.
I have one
mean,
more thing to add.
yeah.
She didn't know anything about marijuana, and she spent 4 hours at my compassion center being taught.
Nice. Wonderful.
And not every doctor will do that. They all should.
It only took 2 years of nagging.
But then she
Well,
saw,
and I hear
she saw
this-
how
this-
I changed.
I hear this story though too, so we have a few physicians that work with us. Dr. Tammy Post is in Fayetteville, and she said the same thing. It took her a long time. She thought of it like reefer madness. She didn't think of it as medicine, but once she looked at the science, she couldn't deny it.
Well, it's not even reefer madness. It's just we never believed in narcotics at all. So we had maybe 3 patients in the whole practice of 6,000 that we gave narcotics to. It's just not something we ever supported. And so to me, it was like, well, if I don't give narcotics, why in the world would I give medical marijuana?
Okay,
But then,
right.
but then I signed off and got morphine.
Yeah, well, then I learned, poor Lois had
I coded.
she accidentally overdosed and on a horse's dose
5
of
minutes.
narcotics.
5 minutes more and I wouldn't be sitting here.
Yeah,
Wow.
so the medical marijuana or cannabis was
Lifesaver.
life-saving for
Right.
many.
And also it's food. I'll tell you, when I say the entourage effect and using all different ways, I also juice the leaves.
Nice.
I have growers, give us
You're lucky.
leaves.
Yeah.
In Massachusetts,
Yes.
we have full legalization, so we're able to take medicine from growers and gift it to patients. And we're actually working on that program further. We have a compassion director now.
Wonderful.
We can't do that in Connecticut, but we can do it in Massachusetts. But the leaves, I'm telling you, to reduce inflammation, that shake with the leaves and other things, other healthy things, throw it in there, kale, whatever you want to throw in there, whatever you like. I've woken up, swollen joints, take a shake with cannabis leaves in it, and within a few hours, the swelling's gone.
Use butter a lot.
Um, Yeah, we have someone who makes butter. We have somebody who makes cookies from the butter, and then we have a little butter left. And we gift it, in Massachusetts.
When are they gonna open up the dispensaries, like, for recreation?
It's
It's a
gotta
good
pass.
question. They're still hashing all that out. Hashing it out. But yeah, I mean, it's right now you have to have a medical card to go in the dispensary, and hopefully that will all start to change. There is some movement in progress, but there's so much to do though. I mean, veterans still, veterans, it's a huge issue with the Veterans Administration. Veterans who want to come off of their opioids, they don't have cannabis as an option. And it's really disgraceful, actually.
And when I was going through withdrawal, I had my license, but I'm not allowed to do the medical marijuana, even edibles, in the hospital.
Well, that's
So,
another issue.
Yeah, if we could fix
Right.
that, if I could have had that, I wouldn't have needed Ativan.
Well, here's where it starts. One of the
Because they were so rocking and they could tell just from their own vets and
Not that
Yeah,
though.
not a medical marijuana.
Not that though.
No, you can't do that.
The last time I was in the hospital, they told me I smelled like marijuana.
Yeah, but
The
I'm saying
nurses,
not
the nurses kept coming in and saying we smell marijuana, and I didn't have anything on me. I was in the hospital, but it was horrible because again I'm deteriorating, and I decided to take their morphine because I'm in pain. And but my friends who were visiting all smelled like marijuana, so it wasn't me. But they didn't believe me. They treat you like a criminal, you know. It's horrible.
legal. I smell them.
Like to say,
Yeah.
speaking of doctors, for years my doctors questioned me. I've got 2 sheets of paper of allergies to medications. And I had a new primary care, and she literally lit it to me, told me I was psychologically, kidding the world. That I needed to go on drugs, I needed,
Mhm.
my eyes, and she was not gonna see me or treat me, and she was gonna notify me of the doctors. And so through that, I had to go to a psychiatrist. And my cardiologist writes an article for the day once a month. And he put me on a blood pressure medicine that was really psyching me out really bad.
Mhm.
And I tried to tell him that it wasn't me, that I wasn't anxious or depressed or anything. It was the drug they had given me that believed me. So
Well-
I ended up at Pond House for a week.
Wow. I know that's the
We
thing.
just
There's
wrote a-
sensitivities. You can have an allergy or sensitivity to anything, even cannabis. You know, it doesn't really happen very much, but it can happen.
But I mean,
you know?
he just wrote a I guess you could call it article, saying that he's been having trouble. And now when people come in with the end of their list, he just kind of says, okay,
Right,
because he knows. So I was really glad to see that out in the open.
right,
I don't
Right.
know how much it's gonna do, but it was an addition to the.
right. Well, that's good. I mean, everything that's a little progress. You know, the thing with the pharmaceuticals is what I learned is after 2 drugs, they don't really know what the interactions are.
No.
So, you know, you start adding 3, 4, 5 drugs. And, you know, many people, especially young people, are on at least 3 drugs. Something for depression, something for gastric reflux. What's the third one? Oh my gosh.
Anxiety.
Could be. I mean, there's people, you know, that's something for sleep. There's 3 drugs at least, you know, and young people, what I'm finding as I go out and talk and do this project, you know, they have been indoctrinated and raised on taking pills. And so they think this is crazy, you know, and it's very upsetting and worrisome because it's, you know, it's the drug age. I call them drugs, not medicine, because really they're just mainly treating symptoms for the most part. Like I said, they're not all bad, you know, but, you know, that's really what's happening. So did you, I'm sorry.
Yeah, I just want to relay something that happened the other day. I was talking to a patient who's, you know, having trouble with medical cannabis, and that, well, you know, I feel, and she says, I feel uneasy going out. People are going to think I'm stoned and I'm not right and everything else. And I said, well, do you feel better? She says, yeah, I feel fine. I says, okay, understand this. This is all evolving around the endocannabinoid system, which was discovered in like 1995, 94, something like that. It hadn't even been taught in medical school up until
It's still
then.
not.
Still not.
Right, that's another
So,
problem.
They're starting
Yeah.
to learn right now how this system works in the human body. She says, well, where is it? I says, well, to help you understand, okay, you got your hand, and you cut this finger, and it's bleeding, and your body goes through a healing process to make this finger work. How did that happen? How did it know to do that? Well, that's what the endocannabinoid system they're figuring out does. It finds a way to balance out what's out of kilter in the body and make it normal, whatever that is. Or
Well, it's called
what kind of
homeostasis.
homeostasis?
It's homeostasis.
Yeah,
With
homeostasis.
right balance.
Right, so to follow on what you were saying, that's what's happening. When you use cannabis and all the other different terpenoids and cannabinoids that interact with the endocannabinoid system, you get this relaxation. You say, well, I'm stoned. No, it's your body reacting to the fact that it's normalized.
Right.
And then all these toxins are.
And she says, I mean, that's what's happening? It's a medical thing that's actually going on in me? And then, yeah. She
Some
says,
Some of the
changes
balance for the system, you might want to tell her, is what you always want to have is your optimal level of arousal.
You don't want to be over aroused and you don't want to be under aroused. You want your optimal level of arousal, and that's when your body works its best in every category. So tell her, if you tell her it's working on that system and is getting her optimal level of arousal where it needs to be so she can be the healthiest person, that's
You were saying earlier, keep a journal, keep track of what you're doing.
Absolutely.
Know what works for you.
Right. I mean,
Everyone's different.
the thing is, there's all different strains. There's so many different cannabinoids. THC is not the only one. CBD, CBN, there's like an endless list. And so it's really important. What's good and works for you might not work for somebody else at all. As much as I use cannabis every day, but I'm a lightweight. I don't like things that are high in THC. I like things that are really high in CBD and that are more of a sativa because I need that energy boost. But I do keep an indica that's heavy. If I can't sleep, that's what's going to put me to sleep. So one of the things I love about cannabis and about using all of these other health methods is you're in the driver's seat and you get to learn about it and decide what's going to work for you, and you have hopefully a health professional that will stand by you and be there, but really it puts you in the driver's seat of your own health, and that's a great thing. And you identified another problem that we still need to work on. Physicians all need to learn about the endocannabinoid system. It's still not taught in medical school. I know that that's something that Dr. Uma's really passionate about. When she comes to Washington with us, that's one of the things she wants to talk with congressman about, that she's continuing to talk about. It should be required curriculum for all physicians, just like nutrition. You probably had some nutrition training because of where you went to medical school. It wasn't here,
Yeah,
right? But the doctors here get very little training in nutrition, which is what is the building block of everything.
Who's Dr. Uma?
She's a physician in Massachusetts. She's an activist. No, she's an activist. You can look her up, Dr. Uma Dhanavalan. I mentioned her, Dr. Steph, Dr. Tammy Post, Dr. Uma, they are pioneers, and we're so grateful for them because, we are all meeting here tonight because we want to improve our health, right? And what's available to us, the pills, tests, and surgery isn't doing it. There's a place and a time for some of it, but really we're talking about ideas that unfortunately are still fairly new or not even heard of to many, many people. They're busy looking at their phone, working 80 hours a week, trying to make ends meet, buying the processed food, the meat at the dollar store or whatever. And not out of their fault of their own, they have no time to even make those changes, or the time to become educated. And so as we learn, it's like a ripple in a pond. We talk about it with somebody else, and then they learn about it, and they start to look it up, and they talk to somebody else. It's wonderful, right?
If I can interject something, I was on sleeping pills from the age of 18, and I really could not imagine not taking them. Cannabinoids. I sleep soundly. And oncologists need to get on board.
I think they are.
Well,
Not
it shouldn't be a last resort. That's the thing. It becomes a last resort for physicians. They go through, because, like when I became really ill, the doctors have a protocol that they're supposed to follow. I mean, you probably know more about that than I do. That they're supposed to follow with the pharmaceutical drugs, and they get in trouble if they don't follow it.
Because your insurance won't pay unless they do this first and we
Right.
decide.
Right. So for them to change it up and make cannabis a first-line drug, or talk to patients, heaven forbid, how much are you moving your body? Are you getting enough sleep? What's the stress level in your home? And actually take the time to learn those things, because all of those things, a doctor just asking a patient about those things is like gold. Because, because the doctor then is showing their concern and caring for the person's health, not just taking out their prescription pad and writing another prescription.
On your website, do you have this, or other referrals to different websites, like how to take different kinds of marijuana, what this things have already been examined and looked like.
Right. I actually,
I
we-
can tell you.
she seems really knowledgeable. We don't have it on our website.
Background because she's so knowledgeable.
It seems like it's
It
one of the
is,
ones that really
right.
works on.
We don't have anything like that. I know, you know, but we're I know not just so we have a new compassion director, and she's working on a lot of things, including you know the on the Bulldozer Health Show we have many interviews about cannabis, about all different things related to cannabis, but we actually need we've talked about this for a while, things that people can print like on the website to learn about various things, or educational videos. So that's something that we'll expand on. I'm not sure. I know in Connecticut, so Dab and Dad. Do you guys know Dab and Dad website?
Oh, yeah.
So Dab and Dad has a lot of information on their website, including in Connecticut, I was so shocked that they changed the names of all the strains. It's like, it's crazy.
It is crazy.
Like you go to the dispensary, and if you want, Bubblicious, it's renamed with a pharmaceutical-like name.
That's what K.
Yeah, right? And so people don't know what they're getting.
Too many lawyers, and sometimes they put another letter in there.
Yeah. So Dab and Dad has the key to what those are, if you're interested, and lots of other information. And they have helped sponsor some of our things. I love them. So, and Leafly is great. But the thing is, because Connecticut changed the names, you have to know what the name is. And I think it's really insulting to the consumer. So that's again another thing that we all need to work on and use our voice and say, this is unacceptable. I'm a patient. I want to know what I'm getting.
Good for Island. You can't get dick there. Excuse me.
No, excuse me, I disagree.
Well,
I'm the medical marijuana advocate for Rhode Island.
Wonderful.
So,
there-
we can talk
there-
after.
there's a selection there.
For the selection.
It's not
Well-
the selection, it's different, like it's a community, you're allowed to talk to other patients, in Connecticut, you're not.
Right, Connecticut is really difficult.
I mean, you can grow in Rhode Island too.
Yeah.
And I can give
Well-
It's really a
stuff to
good
do
state
and-
for it.
And here's the thing, some patients aren't really for full legalization, but it's really important because grow rights are human rights. You should be able to grow if you want to grow, or if you don't want to grow but your friend is going to grow, you should be able to get access there.
I was on Vicodin when I first started this, and my neurologist, when she found out, she put me on random drug tests.
Mhm.
Oh, man.
Oh, right, and then you can't,
Wouldn't give me
right,
medication
mhm.
unless I had to wait a week, and then went and picked it up, but I had to.
because they treat, it's criminalized. They treat the medicine like,
All the other crap I was.
right.
That's absurd.
Right.
It is.
It should be.
Before I came here today, I solved a little problem the other day with, if you get dab, you know what that is, right?
Yeah.
And it's such a pain in the neck to use it, and however you gotta do it with it, it's just like.
You feel like a drug
This
addict,
doesn't
even though
work
you're
right.
not.
Well,
It's just the way you have to
a friend
do
of
it.
mine,
It's a ritual.
you know,
Yeah, it's a
I mentioned
ritual.
a patient friend of mine, well, she tried to get the dab out and got out a tool, and I walk into the room and it's all over both hands.
Oh no!
And the little container is covered with a tool, and so is the tool, and I'm there like, okay, Ziploc bag, good handful of coconut oil, threw it in there, and I said, here, stick both hands in the bag with everything you got, just keep on rubbing it off.
Oh my goodness!
It comes off. Not the end. It all came off. It's in the bag, now it's in the coconut oil. I said, great, this is THCA. It has not been decarbolized,
Right.
which works really well, like you were saying, on the raw.
Mm-hmm.
It
Raw
works really well on
cannabis.
anti-inflammatories and all the other stuff that
Right.
THC regularly does.
Right.
So now I got this wonderful cream, and I'll tell you, I got bad neck. I just put it on there.
You gave me the cream, it works.
Well,
Oh, this is new stuff.
it's amazing,
The old cream is great.
No, I found a new use for deck, okay? Because it's a pain in the ass to use the way it is. So now I say, well,
Well, we
Get
put it
the
in
right
the
stuff.
freezer for 30
Well, if you have
seconds.
skin issues, so the dermatomyositis can recur. I have, it hasn't happened to me, but I had the circles on my hand a couple of times, and I took infused lotion, put it all over there. Within 24 hours, it was gone. You know, and it helps with psoriasis.
They call it
Yeah.
rosin, they call it rosin.
It's
or
concentrated.
wax.
Do you buy it as a?
In the dispensaries, yeah.
It's, you buy it as a concentrated, like, it either comes in a waxy or like a sticky, sometimes it's crumbly, but it's a concentrate. And then what he's saying is he mixed it with coconut oil and used it topically.
So
And
it's
coconut
It doesn't
oil is
come
no.
with-
Took away all
So
the pain,
the dabbing is it's a concentrated form, like she mentioned, and you have to really heat it up, you know, and
Oh.
and
You have to have the
with a
right-
blowtorch, and you smoke it very quickly, and it really does take all the pain
It
away
really
if you're a
does.
pain
If you
patient.
need high medicine,
Yeah,
you know,
yeah.
heavy
But-
hitting
I've
medicine.
also put a drop
And
on
anxiety,
top of the bowl,
too,
like
really.
melted on top
Oh,
of the
yeah.
flour.
Yeah.
They talk after
But I don't know. So do they sell that in the dispensaries in Connecticut?
They do,
Okay.
yes.
The difference is-
But you just need a special rig to do it.
You're like the one in the, I like the one in the, one comes in a syringe.
Oh, the
Okay.
drops.
Yeah.
The drops
And
and
they
they
shot it
shot
across the room.
Oh no. Oh no, that's awful.
It's also not cheap.
But-
It was $71.
Wendy, the point I wanted to make is that THCA, you know, the undecarbonized, and I'm gonna get a little scientific, but THCA is the natural occurring oil in the plant. And when you apply heat to it, all the cannabinoids change composition and they become active. Like THC comes out of THCA, so does the CBDs, comes out of CBDA. They all exist in an acid form, which is an oil first. And they get broken down by heat. Now, the acid form has a real benefit health-wise. So you don't always need to break it down with heat. You don't have to smoke it all the time. Matter of fact, as a topical, it has a bigger effect on muscle pains and joint pains and all
Well,
kinds
even
of stuff like that.
CBD products which don't have THC or have the allowable 0.3% of THC, which I believe you actually need. You can get CBD products with no THC, but again, for the entourage effect, I really feel like you need that little bit. But you know, there are many great CBD products. You just want to know where it's sourced. Make sure it's organic and not sourced, you know, in China, where what they call organic is growing in, you know, a trash heap. So so you want to make sure, you know, we in our network we have high purity hemp oil. It's sourced in Vermont. If you look on our website, you'll see that. We also have the Healing Rose. If anybody's familiar with those topical products, they're amazing. I have some in my purse. I rub it. I mean, if I'm, you know, feeling pain, I mean, I'm rubbing it all over in all my joints before I go to bed. It really helps, and it doesn't make you high. And the leaves, too, if you're juicing the leaves, take a look on YouTube at raw cannabis. There's a lot of videos. Raw cannabis is really good for you. It's a superfood, just like, you know, chia seeds and hemp seeds. And hemp seed oil. So hemp seed oil is, you know, antioxidant, rich in vitamin and B vitamins. It's so good for you. I cook with hemp seed oil now instead of some of the other oils. I will use extra virgin olive oil because I like the flavor, but I always add in a little cold pressed hemp seed oil. It's not even very expensive, but again, you have to make sure it's organic and sourced either in Canada or in the U.S. In the U.S., there's, I believe now it's 14 states where you can grow hemp because Massachusetts was just added. I don't actually know if you can grow hemp in Connecticut. I think you can now. Actually, I think newly you can now because I just noticed on my Facebook page someone, an activist who has done some work with us, is involved in a hemp grow. You know, hemp is very similar to the cannabis plant. It's just a little bit different. It's not, you're not going to get high from it, but those, you know, organic hemp seeds, hemp seed oil, it's all really good for your body.
I have a quick question. What do you think about CBD from hemp as opposed to CBD from cannabis?
Well, you know, the legal
Is hemp.
is hemp. It's sourced from
I
hemp.
get it, but I feel
Right.
like I personally think that CBD from cannabis is better, but I don't know if that's true or.
Well, you know, so I've sampled lots of different ones. The Healing Rose also has, you know, a sourced hemp oil that you can take internally. It comes in the syringe like you described. Really great for anxiety. You know, I think you have to look at where the product is from. Is it organic? And you have to try for yourself. I have seen some success with taking the hemp CBD oil daily to just take the edge off anxiety and PTSD issues. So yeah, I mean, and I again, if it has a little bit of THC, it's gonna, you know, in my opinion, it's better. You know, yeah. But you know, even without the recommendations, you can try CBD products, whether it's the topicals, or the, you know, taking it internally. I have seen success with the different issues that I have with just the CBD. And I say just, but it's really, you know, it's medicine and food.
Wendy, I see some first-time patients here who have absolutely no idea. What would you recommend for them as a starting point?
Well, the first thing I would do is really start to educate yourself. You know, take a look at, there's lots of great information. If you are into the science behind it, Israel is where you want to look for articles, because in the United States it's still a Schedule I drug. It's not been looked at in any kind of a scientific way. There's no real studies. But start to educate yourself about that and what you know, different strains people use for different things. Like look through Leafly. You know, I think you can actually put in there like anxiety, and, you know, and then it'll show you different strains. If you have your card and you're going to go to the dispensary, you know, go and look at that first. Go to Dab and Dad and figure out in Connecticut what that is, what the name of it is. Try it. You know, just take, you know, whether it's, I am a proponent of smoking. There are no studies that show that cannabis causes lung cancer, or in fact, some people have seen improvement in their asthma and COPD with smoking it. I can't, yes, take a look. It's very interesting.
I remember this,
But
misinformation being out there, like one joint is equal to smoking 50 cigarettes, you know, that used to go out all the time. And
it's
just,
propaganda,
It's all
you
propaganda,
know?
I know.
Right, but
And people still, like,
so
after
when
the
you
Freedom Rally, I'm
yeah,
sorry,
go ahead.
to interrupt, but even after the Freedom Rally, I went to the New England Freedom Rally in Boston, you know, it was a wonderful time, all these people liked it, just, even I ran into a young gentleman around, younger than me, who said, cannabis is a gateway drug, you know, still stuck.
And he was at the rally?
No.
Oh.
I was telling you what I just had taken, I was so excited about it. He was very, you know, this was what his thought was about it, and I just, people still think this.
Right, and that's where, you know, continuing to educate and telling them, yes, it's a gateway to health.
Yeah.
That's what I tell
Yeah,
people.
exactly.
It's a
I
gateway to
I
health.
said it was an
you know.
exit drug,
Right.
not a gateway.
It is an exit drug from opiates and other drugs, for sure, you know, and unfortunately, most of the stories are anecdotal because there's no scientific studies in the U.S. because they can't, you know. I interviewed Dr. Sue Sicily back a couple of years ago. She is, I don't know if you know who she is, she actually is the first person who got federal funding to do studies with cannabis for veterans with PTSD. But here's the issue, the cannabis had to come from NIDA, from the federal government, and they weren't releasing the cannabis for her to start her study years later, you know. So, you know, there's so much that we're up against. But yes, start with, you know, a little, you know, educating yourself, and then when you go and try, you know, buy a small amount of a couple of things to try that you've looked up, you know, for your ailments, and then keep a journal, you know, how did it work for you? And look at the CBD products, because I don't know what your issues are, but the CBD products, you know, CBD hemp oil can be really helpful. And if you have pain, I'm telling you, those topicals, really good quality. I love the Healing Rose. I don't mean to plug different things, but I've tried all different products, and the ones that I know I've seen work, you know, and you know, they do network with us, and very loving, caring people who care about the product and want the feedback. And when you see that, you know that they're good. You know, they want to hear, did it work for you? Did it not work for you? and they have everything from lip balm to, topicals, that you can put on your body, massage oils.
Bubble baths now.
Yeah, she actually let me try one of their bath bombs. It has CBD in it and lavender. Fantastic and really great for your skin,
So the good part is you cannot overdose and die. So nothing bad is going to happen, but you also don't want to be incapacitated. So the whole point would be to start at the very lowest dose and slowly increase.
Great advice. I didn't know anything about edibles. I'll tell my little edible story.
Don't we all have an edible story?
So we were in Rhode Island, and for Bulldozer helped all around town trying to get sponsors, and I didn't bring medicine with me. It was sort of in the beginning. I was very nervous about really following every rule, which I still do. And so at the end of the day, this grower who was with me said, I'm in so much pain, I didn't bring anything with me. And he said, okay, well, here's a peanut butter cup, and that'll help, And I didn't ask him what strain it was. I didn't ask anything about it.
Did you know the milligrams or anything?
I didn't ask. I don't know why. And so I took the whole thing. I ate the whole thing. And I started driving, which don't do it. But it doesn't kick in for like an hour, right? But, I was driving to Worcester from Providence, and it started, the yellow line started coming up like this, right? And the lights were crazy, and I'm like, I thought I was having a stroke. I was like, what is going on, By the time I got home, I couldn't even walk up the stairs. I had a housemate at the time, and I'm, Yuli, come help me, please come help me. This guy gave me this peanut butter cup, I think he's trying to kill me. Like, I was like, really? And then he kept saying to me what Dr. Steph just said, you're not going to die. Nobody's ever died. But I will tell you, it was too much for me. The dosage was too high. You can end up with diarrhea and vomiting if it's too high. So take it slow when you're first starting. Edibles are really not for me. If I'm going to do it, I'm going to take a very small amount. My friend might eat a whole cookie. I'll take like an eighth of the cookie, and eating it is preferable to a lot of people, but you have to realize your own body and what will work. And, sometimes the smoke is really helpful. You can vape it, you can smoke it, you can take the oil. I contracted Lyme disease last May. And, and so I took, Fico or Rick Simpson oil, whatever you call it, along with the antibiotics. And I really think it made all the difference in terms of not having the chronic pain from the Lyme. But Lyme is a whole other subject. It's an epidemic, and the government isn't really addressing it. So that's a whole other topic. But I do think that the concentrated oil, really helped my body to come back into homeostasis, and so that I could continue on. But
Continue your fine work helping others. Yeah.
Yeah, I just want to add one thing. I have a friend who had early onset Alzheimer's. He got it when he was 59.
wow,
It was brilliant.
right.
So I thought, well, try it.
Sure, yeah.
The difference, I could just cry. I saw it myself.
Right.
The difference is like from to be interacting,
Nice.
music, taking photographs,
Right.
making jokes.
Right.
So now we get to,
Right, that's great. Yeah, I just read a study about that. They actually are seeing some success. I worked in mainstream medicine, like I said, for 25 years. I worked in nursing homes. There's no way I could ever, even if I was able to lift patients and do that stuff, there's no way I could ever work in that environment. The list of pills is unbelievable. I know people with Alzheimer's are, if it's a good place, they're treated with respect and just cared for, but you don't see, in the mainstream, there's nothing that's really going to cure that or take it away. But they are seeing some improvement with cannabis. Yeah. Yeah. And really, even at that time when I was in the nursing homes, they were prescribing Marinol, Now, the issue with Marinol is, it's not the whole plant. So, we're giving it to elderly patients to help with appetite, but, and that's been going on for a long, long time, but it's not the same thing as really giving them whole plant cannabis. And, it's my dream that there'll be hospitals and nursing homes and all of these health facilities where it will be allowable
Well,
and,
sure, because it's
you know,
money.
right,
Right, it's gonna be our age group, my age group.
Right. right.
You know, and then if you happen to have a couple bucks.
Right, and there are actually a couple of cannabis friendly nursing homes now that have popped up.
Really?
And there'll be more of it.
Give my husband a name. He always threatens.
Yeah, you go there though, right?
Right? He needs my medical marijuana.
Wendy, I just said one other thing. I mean, the whole issue of whether it's a medicine or not bothers me because I see how it's being put together and grown, and it's really the efficacy is questionable sometimes, and that's probably something to do with the resistance to something, an excuse. So I thought, why don't we just treat it as a natural supplement, an herbal remedy, and keep on that path, and maybe we'll avoid all the complications with the FDA, the DEA, and all that other stuff.
Well, I think for now that's good. I mean, I think that won't make it accessible for most people, after spending time in other states around the country. As hard as it is in Connecticut, at least there's medical, right? But, there's many areas of the country where there's nothing. People are choosing whether they're going to be a criminal or have what really works for them. So I think that that's, a step in the right direction. I think we still have to keep fighting till it's descheduled, till doctors can write prescriptions, people can use it when they go to work, or after work, or whatever they need for their health, and we just have to keep up that fight. We've come a long way. Listen, I'm 53. I never thought I would see what's happening now. And it's good and it's bad, because it really has become a classist system, just like healthy food and everything else. It's all due to greed. And so we have this fight in front of us for all the things we talked about and having it available to all of us, It should be available, whether someone wants to use it or needs it or thinks they need it doesn't matter. It should be available to anyone who it could help.
Exactly.
Which goes in line with your question, I'd say we should be growing, be able to grow our own medicine.
Grow rates are human rights,
Small steps,
Yeah,
I know.
Rhode Island, you can grow it.
Right.
You can
And
legally have
Senator
a garden
White
in
House is
every
for it.
state in your, like your front yard.
Well,
To
right.
grow certain places and have even grow your food.
Right, I mean, we started a community garden, it's in my yard, because we're a grassroots organization, we operate out of my house. So the front and the backyard are our garden, organic garden, and anybody who needs food can come by and pick it if they want, or hit me up and say, what have you got? I wish, I would drive down the street, and of course there's this big garden in the front yard, and the volunteers, I don't do the garden, the volunteers all did the garden. I take pictures of people in the garden. But they put these huge sunflowers in the front on purpose. They're gorgeous. And people were coming from everywhere to see these sunflowers, and they're like, oh, there's vegetables in the front yard. If every house on the street had that, we could all share food. There'd be way too much food for all of us,
Yeah.
And if the parks, if you could, I saw on Facebook someone encouraging people to just plant a fruit tree in the park. Just go to your local park and plant a fruit tree, right? Someone said to me, oh, you'll get arrested if you do that. I don't know if that's true. but I think it's just, why we're wasting all this land. It should all be edible, And it would be great if you could grow your own medicine. We grow rosemary and we grow many other herbs that people pick up and make tinctures out of. But really, in Massachusetts, even though it's legal to grow, you can't grow outside in the full sun without a 12-foot fence, locked fence. But you can grow. So again, step in the right direction. It's great. But everybody should be able to grow their medicine. And I did a talk like this in Massachusetts. I think it was a couple of years ago. Anyway, this woman came. She was almost 90 years old. And she grew up in Colorado before Prohibition, and they had it in their diet. The family all used cannabis. She takes no pharmaceuticals. I mean, it's an anecdotal story, right? But she's like, Wendy, I'm in this rest home. I can't even talk to these people. They're drugged. And here I am, healthy. I've been using cannabis my whole life, So, I mean, I was excited about that. Because I'm hoping that, my kids' generation will see even more progress and be able to grow it. I had my son Jacob, he was, they diagnosed him with ADD. What I know now, I didn't know then. And put him on drugs, and when he was a teenager, now he's 27, it's like, I was throwing that away and using cannabis a long time ago, and I mean, I think, he had learned about it and researched it himself, and, I just think that's really what it's all about. This is your own body, you should be in charge of what you put into it.
Excellent.
It is. You were amazing.
Yes, Wendy,
thank
thank you
you.
so much. Wonderful.
Thank you for having me. What a great group.